warm welcome to all of you joining us for today's edition of Dil Ke Doubts. I'm Jaya Rebello and I'm really happy to be a host for this very important conversation on understanding diabetes and heart disease, risk, choices, and protection. Now, before we begin, a quick introduction about me. I work closely with non-profit organizations and community groups to build awareness around public health and community well-being, especially in the area of women's health, preventive care, and community education. I'm also actively involved with the Heart Health India Foundation here in Mumbai, where I support patient advocacy and outreach efforts. Today, we are diving into a topic that touches almost every family: diabetes and heart health. We often hear these conditions mentioned separately, but the truth is they are very closely linked. So, in the next hour, we will explore understanding risks and what really happens inside the body, daily choices and what do they do inside our bodies, and what we can do to protect ourselves in the long run. Now, before we move ahead, I'd like to acknowledge our partners for today, the Society for Cardiovascular and Pulmonary Rehabilitation, SOCVPR. They are doing phenomenal work in strengthening patient care and recovery systems across India. Together with HHIF, they are helping create safer, stronger recovery journeys for patients and families. HHIF is proud to collaborate with them for today's conversation. And now it is my absolute pleasure to introduce our speaker for today, Dr. Varoon C. Jaiswal, a cardiovascular and respiratory physiotherapy specialist. He serves as professor and head at Myers Physiotherapy College in Talegaon, Pune. Dr. Varoon works extensively in cardiac rehabilitation and exercise prescription, especially for people living with diabetes, hypertension, and heart disease. We are so glad to have you here with us, Dr. Varoon. I'd like to invite you to set the stage for today's discussion.
Thank you, Jaya, and thank you, Pratiksha, and thank you, Heart Health India Foundation, for inviting to me this series of Dil Ke Doubts. And I'm very happy, or I'm very glad that I've been invited as a speaker or to create the awareness. Am I audible? Okay. So the topic is very important for today. As Jaya said, that diabetes and heart disease are interlinked. The first part, that is the diabetes. Basically, India is today the world capital for diabetes. The maximum number of diabetic population is coming from India. So we as a community as a whole should look into this condition, why we are emerging as a diabetic capital of India. That is the question of the hour. And secondly, in my entire talk, I will be enlightening everyone by this podcast or by this meeting how to stay away from diabetes. If taking into my personal story, I come from a family where my father, mother, grandmother, grandfather, my real brother, elder than me, all are diabetic. And I being following the principles of lifestyle modification or lifestyle enhancement, what I say, I am still a non-diabetic person. So that is what I'm going to convey today, how to stay away from diabetes, because diabetes is one of the major risk factor for coronary artery disease or heart disease, what we call it commonly. And secondly, India is again the capital for heart disease patients. And sadly, we all know through the media today, the social media or the news media or the print media, we see every now and then young, successful or young people are dying with sudden cardiac deaths. So what could be the cause? We always see that they are very fit, they're running marathons, they're successful in their life. But what we are missing, what is the missing link that we are going to highlight today? Okay, so let's get started. We will also take the questions from the audiences, and I'll be happy to answer them. Yes, Jay.
Thank you, Dr. Varun, for those powerful statistics that you suggested. It's really an eye-opener. And we'll now move into the interactive Q&A session. I'll begin with a few questions, and to the audience, I would request you to put your questions in the chat box. And once we go through the session, we will address your questions at the end of it. You could either put it in the chat box or unmute and ask the doctor directly. So, doctor, the first question that I would like to ask was that diabetes often progresses quietly. So, what exactly happens inside our blood vessels when the sugar stays high for months or years? And how does that increase the chances of a heart attack or a stroke?
Yes. Sometimes diabetes, people say blood pressure or the hypertension is a silent killer, but nowadays diabetes is also a silent killer. That is because of our lifestyle. Normally, the first thing is the ignorance. We try to ignore our regular checkups, and the blood sugar levels or the hyperglycemia or the diabetes, what we say, it comes up very later and when we become symptomatic. And it is normal saying that if we catch the disease in our early stages, it is very easy to treat that disease. The same goes for diabetes. So, because of our lifestyle, we have been addicted to processed foods. We have been addicted to not moving our body enough because of our lifestyle. We have to sit in front of the laptop or use elevators, skip the stairs, or take the car to our office or any other vehicle. Our body is not moving actually. So that causes insulin resistance in our body. And because of insulin resistance, there is a lot of hyperglycemia, or there is the blood glucose levels are always high in our blood. And the one basic thing which starts with high blood glucose levels, and that is the basic start for our coronary artery disease or heart disease, that is endothelial injury. Endothelium means the inner layer of the arteries. Arteries, we all understand that arteries are nothing but the pipeline through which the blood flows in our entire body. So these pipelines gets injured because of the high blood glucose levels. And this happens very subtly, very silently, even before we become symptomatic. Like we all know that the symptoms of diabetes, when we get a lot of urination, the frequency of urination increases. We get a lot of hunger pangs, okay, and we become thirsty now and then. So these symptoms come a lot later in the disease stage, where when the disease are set in our body. So before that also, the endothelial injury, as I said, the injury to the blood vessel wall, the inner wall of the arteries, keep on happening. And that injury is the first step of the coronary artery disease or the heart disease, which leads to deposition of cholesterol in our arteries. And the size of the arteries reduces, the inner layer or the inner diameter, or the, what do you say, the lumen or the inner diameter of the artery starts reducing, and it creates a blockage, is what we call it in the common man's language. So the size of the blockages increases, and the heart disease surfaces when there is a complete blockage of the arteries. So even when there are no symptoms, the process of heart disease, because of the increased glucose levels in our blood, keeps on going because of our lifestyle, because of our increased intake of processed foods, in reduce in the physical activity, reduction in the sleep quality. So all because of that. So it starts setting in silently, as you said. So there is an endothelial injury, or the injury to the vessel wall, or injury to the pipeline of the blood or the arteries, which is happening.
So, doctor, just to clarify, so this when you say diabetes, is this type 1, type 2 diabetes, or is there
Yes,
any
so
kind of
there are two types of diabetes, type 1 and type 2. So type 1 is basically the from the onset of the birth or early in the age. It starts with the childhood. That is the type 1, and it is because of the malfunction of the pancreas. Pancreas means it is the organ which secretes the insulin. So insulin is the hormone in our body which plays a role to transfer the glucose inside the cell, so that the metabolism of the glucose happens inside the cell. So if there is lack of insulin, the glucose will not move inside the cell. It will keep circulating in our blood. So that is type 1. And type 2 is when there is insulin resistance. So insulin is there in the body. In type 1, there is lack of insulin. In type 2, the insulin is there, but our cells become resistant to insulin. The insulin is not able to perform the function which is supposed to perform, that is transferring the glucose inside the cell so that the metabolism can happen, and the glucose keeps gets circulating in the blood, and there is a stage of hyperglycemia or raised blood glucose levels. What we see in our blood test, that blood glucose level is more than 140, or sometimes it's 200, sometimes it is 300. Or normally today's people, they do HbA1c, glycosylated hemoglobin, it is more than 7 8. So that is what comes in our blood reports. So that is type 2 diabetes because of the insulin resistance.
So we often hear about A1C, blood pressure, and LDL cholesterol. Can you help us understand how each of these affects the heart and arteries? And what
Yes.
changes happen when these numbers stay out of range?
Yeah. So HbA1c is the first test, or rather, I'll say it is a very important test. It gives you the average of 3 months of blood glucose control. So generally, what I recommend to my patients is your A1C level should be less than 5, or at least it should be less than 5.5. If it is more than 5.5, then there is some kind of hyperglycemia or the blood glucose levels are high in your blood. So it is average of 3 months. So generally, when we do a blood glucose level test, a random blood glucose level, I'm not talking about HbA1c now. So it just give you the blood glucose level at that point of time. So maybe you must be hungry at that time, or you must have not had your meal properly. So that levels may not come true. But HbA1c will give you an average of 3 months, which gives you a better idea of your glycemic control or your blood glucose level control. So I'm not recommending that everyone should go and get your HbA1c done on the first place. The test should be done only after the recommendation of a healthcare practitioner. No patient should go and get a blood test done on their own. First, you should always consult your doctor and then get your blood. Whatever test is advised, you should be doing it. Okay, so HbA1c is an average of 3 months. If it is more than 6, then probably you are pre-diabetic. If it is more than 7, then you are clear-cut diabetic, type 2 diabetic, or maybe diabetic. Okay, so that is about HbA1c. If it is more than 7, then as I said in the previous answer also, then your endothelial injury or your arteries are getting injured. Okay, your arteries are getting injured. So you have to be careful. Try and bring your blood glucose level, HbA1c number below 6 at least. Okay, you should be taking medications on time, or you should be following all the lifestyle uh, advices which has been recommended to you by your healthcare practitioner. Okay, second thing is LDL level. So LDL level, there are two types of cholesterol in our body. So HDL and LDL. So HDL is a good cholesterol. It tries to reduce the clots in your arteries. Okay, and LDL is a bad cholesterol. It enhances the clots in your arteries. So more the triglyceride level, the more the LDL level, that means the chances of building up clots in your arteries are more. So that is the second test. So if the LDL levels are more than 100 or 110, then probably something you're not doing correct. Okay. Yeah. So that is about LDL. What was the third test, ma'am?
The blood pressure.
Yeah. So blood pressure levels, again, like diabetes, the blood pressure is also a silent killer. It doesn't show any symptoms till you get a disease itself. So it is always recommended to get your blood pressure checked by a nearest general practitioner. I'm not saying you go to a general practitioner every alternate day and get your blood, but at least once in 15 days, once in a month, or you get your blood pressure checked. Because again, I do not recommend my patient to get the blood pressure checked by those electronic machines. There are a lot of wrong readings, incidences coming up with those electronic machines. Okay, so it is better to get it checked by a healthcare nurse or by a general practitioner or by a family physician. Get it checked, maintain your diary, mention your time, what time you have got it checked, what date you have got it checked, what day have you got it checked. So those records will help you to understand what are you doing right or what are you doing wrong. So these three tests, that HbA1c, that will help you to understand your blood glucose control over the period of 3 months. And the second thing is LDL cholesterol, that is a bad cholesterol that helps in or that causes blockages of arteries, can also help you to understand that your diet or your exercises or your medications are not going in the right way. Okay, and third is the blood pressure levels. So normally the blood pressure levels should be less than 120, that is the systolic blood pressure, and it should be less than the diastolic blood pressure, which is the lower one, that is it should be less than 80. You should try and maintain that. Now normally there is a myth. People say that now I'm about 40, and now I'm about 80 or 60. Now 150 by 100 is fine. Even if I don't take a medication, that is also, but that is not right. It should be always less than 120 by 100, because if you are at the blood pressure level 130 by 90 or 140 by 90, as I said, that endothelial injury, the injury to the arteries keep on happening, because the blood pressure is the pressure on the arteries. So if the pressure is more, it is injuring your arteries and it is creating the blockages inside.
So, doctor, they say that sometimes the sugar level looks normal on the reports, but many experts still say that the arteries are still under a lot of stress. So,
Yes.
what are the internal changes that patients should be aware of, and what are the tests that reflect this?
So first thing is, being a blood glucose levels normal is not the only thing that is creating pressure on the arteries. There are multifactorial reasons. First thing is, of course, the blood sugar levels. Second, as I said, the blood pressure levels. Third, the body fat percentage. Fourth is your lifestyle, like how are you sleeping? The sleep plays a major role in your fitness and prevention of all the diseases. There are a lot many research articles, like how are you sleeping, what are your sleep patterns, and prevention of various diseases due to the sleep. And the fifth is your diet, and also stress levels. So even if your blood sugar levels are under control, these factors need to be looked into to reduce the pressure on the arteries. Secondly, about the test, the first, what I recommend to my patients are, every year, I'm not saying every 6 months or every 3 months, every year on your birthday, you should meet your family physician and get a cardiac checkup done. There are complete cardiac profile which is available in all the hospitals now. So that will show you the entire picture, and it not cost you more than 1500 rupees, or maximum in some hospital it is 2500. So generally we order Domino's pizza nowadays of more than that. So spending of 2000 2500 for your heart health, which can prevent you undergo to be under the knife of a bypass surgery, is a very less cost. So there is a packages of tests which you can do, and generally the lipid profile and your C-reactive protein, these tests will show, C-reactive protein will show basically how much inflammation is in your body. So inflammation means your body is under stress, general inflammation. So when there is a lot of inflammation in your body, that means the endothelial injury or the injury to the arteries are still going on. So sometimes it is inevitable, because the risk factors for coronary artery diseases are not only the diabetes or hypertension, which we can modify. Sometimes there are non-modifiable risk factors also, like our age. That is a non, you cannot modify your age. Okay, no one can modify your age. Second, the genetics. You cannot modify your genetics. So few things are not under our control, but whatever is our under control, we have to do it. So you can do these tests once in a year at least, so you know how your body is responding to whatever measures you are taking to keep yourself healthy.
So, doctor, we all like a very carb-rich and outside meals once in a while. And what happens when somebody with diabetes eats a very heavy carb-rich or oily meal? What happens in the body immediately after? And how do sugar spikes, insulin levels, and fat buildup start affecting the heart?
Yes, very important question. Like I have been seeing this throughout my experience or throughout my career when I talk to patients. There are a lot of misconceptions. People go out for dinner and they enjoy a very, we like to eat, all of us, even I like to eat when we go out. All of us are humans at the end. So, but we do not understand how much sugar levels are, how much sugar is there in that particular food. So, for an example, if you go to a five-star hotel and they welcome you with a welcome drink, and we all in a this thing of happiness, we just try and enjoy that welcome drink, but we do not understand how much sugar is there in that particular drink, and that sugar is nothing but an easy sugar. Easy sugar means it absorbs in your blood very easily and it spikes your blood glucose levels. So your brain doesn't know, or the pancreas which secretes the insulin, the organ which secretes the insulin, it doesn't know that it is a easy glucose or a hard glucose or a complex glucose. So it secretes a lots of insulin. So when there is a lot of insulin, the glucose which is easy glucose get metabolized very fast. So it gets metabolized, but the insulin keeps on circulating in your blood. That leads to insulin resistance. So what happens is, if you are going to become a diabetic in 10 years down the line, you will become diabetes in 2 years if you do not pay attention to all these things. So there are easy glucose and there are complex glucose. So like our chapati, brown rice, or simple boiled rice, these are complex glucose. It absorbs through our gut very slowly. It doesn't give you a spike of blood glucose or a spike of insulin in your body or in your blood. Whereas cold drinks, tea specifically, people are addicted to tea like anything. In my experience, what I have seen, all addictions you keep one side. The addiction to tea is on the other side, and it is a white collar addiction. No one says that it is a bad addiction because tea to pee rahe, coffee to pee rahe. क्या होता है? So tea and coffee are the major killers because I've seen people sitting for 4 hours in front of their laptop and sipping coffee, 4 cups of coffee, 3 cups of tea, and they're just sitting on a place and they do not know that these are easy glucose and which is going into their blood and giving them blood glucose spikes, or insulin levels are going increasing and they are developing insulin resistance, and then they complain मैं तो exercise करता हूँ, and then I go for regular gyms and still I have a diabetes, but they do not understand they are consuming processed easy glucose, that those sugar packets what we get, refined sugars, so that is all easy glucose. Juices, we are not meant to drink juices. God has given us teeth, we have to eat the fruit so that the fiber comes along, and that will delay the spike, or that will delay the absorption of the glucose. But we all want easy things, so juices, teas, cola drinks, people enjoy cola drinks with pizzas very happily, but they don't know that they are jumping towards diabetes or jumping towards heart disease. To nowadays, drinking water is a status symbol. People upload it on the Instagram that I am drinking water today. So that's how it is. So we need to understand the difference between easy glucose and complex glucose. So try and consume complex glucose, or even if you are having a high carb diet, if it is a complex glucose, it is good. But if it is a easy glucose, then it is a problem.
So I guess no more tea for me. Because I've never really realized that tea would be, I mean, you've heard of colas and other things, but tea somehow, in our mind, maybe because it is with leaves and other things, you kind of tend to think that it's okay to have tea.
If you like tea, then I will recommend, even I do that. I take black tea,
Okay.
yeah,
So it's the
without
milk
sugar.
and the sugar in it that's
Yes,
the
yes,
culprit.
yes. Even the milk nowadays, it's so much adulteration in the milk. With
Correct.
cows are getting injected with so many hormones,
Correct.
and that milk is coming to us, and those hormones are also going into our body. So that creates a lot of problems.
So, doctor, we all are more or less leading a very sedentary lifestyle these days, and we all know that exercise is extremely helpful. But sometimes maybe we don't understand why. So, if you can explain how regular physical activity supports the heart, and how does it help in relaxing the arteries better, improving sugar control, and lowering the harmful cholesterol?
So first thing I would like to make very clear to all the audiences, like if you're thinking that if you're gymming for 2 hours in the morning and then next 8 hours of the day you're sitting in one place, or you're sitting in front of your laptop or a computer, or you're sitting, whatever you're doing, you're just sitting, then it is of no use. That is the first thing. So 4 hours of sitting is at least your smoke equivalent to smoking 4 to 5 cigarettes a day. So sitting is killing us. That is the first thing. So even if you're gymming for 1 hour, 2 hour in the morning, you need to be physically active throughout the day. That should be the takeaway. So sitting breaks. You sit for 20 minutes, get up, stretch yourself, and move around, and then sit back. Sometimes I recommend to my patients, if you have a continuous sitting job, just do 3 to 5 Surya Namaskar every 30 minutes or every 1 hour. So, what happens when you do a lot of physical activity? The blood glucose levels are under control, the blood pressure levels are under control, the hormones are under control, your stress hormones are under control. So, all these things helps in the body fat percentages are under control. So, this helps in unloading your arteries. And the most important thing is you are tired by the end of the day and you get proper sleep by the end of the day, or when you go to the bed. So when there is a proper sleep, you recover properly, and the next morning you are fresh, and again you are fresh to do the exercise. So regular physical activity, by the way, WHO recommends 150 minutes of moderate intensity exercise in an entire week. So it amounts to be around 30 to 40 minutes a session, 3 to 4 times a week. But for Indian perspective, and if you are sedentary, that 150 minutes of moderate intensity exercise is just a start. You have to build your exercise capacity more than that, and you have to balance it with proper rest, so that you recover the next morning. So that sleep is very important to recover. Okay, no amount of protein shake will bring you the recovery to your body or to your muscles. So a protein shake brings the recovery is the biggest myth. Excuse me. The sleep is the only thing which can bring you recovery, provided it has to be taken scientifically.
So coming to sleep, doctor, we all know these days, we have access to the OTT.
Yes.
We are constantly doom scrolling on our Instagrams and other social media accounts, and that leads to, and I think more, at least for me, the time just before I sleep is this is what I'm constantly doing, because that probably in my mind, it's a way of relaxation for me, but I know it's not. But because of which there is a lack of sleep. You have stress, there are emotional eating that's happening now, which is common. So how do
Yes.
hormones released during stress or lack of sleep affect sugar control, blood pressure, and the load on the heart?
So there are these two hormones, leptin and ghrelin. So first, I will answer because sleep is topic of my interest, because every patient comes to my consultation goes with a sleep prescription, because it is There's a lot of data on sleep, which can prevent you from heart disease. And even if you cannot do anything to lose the weight, or there are a lot of struggle people, in the community nowadays to lose weight and post your pic on Instagram. People are doing crash diets, and again they come back to that same weight after 6 months. But if you try and have a good sleep hygiene, it itself can reduce your weight to 10%. The simple example what I give it to my patients is, even if you go to a party where there is a loud music, but you can still hear your mobile ringtone. If someone, or if some, for example, your wife or your friend or your brother is calling you in that party, you will not be able to listen. But your mobile ringtone is always audible to you. Why? Because the mobile has become like an organ of our body. So what I recommend is, and what I personally also do is, I put my phone on a flight mode when I'm sleeping, and I keep it at least 8 to 10 feet away from me. Ideally, I recommend switch off your mobile and then sleep. But you cannot switch off if your occupation or your work doesn't permit you. At least put it on flight mode. Nowadays, you get a missed call alert, whoever is calling you, and you can call them back. So what happens is, as I said, mobile has become an organ. Even in the night of 2 o'clock or morning 2 o'clock, you get a message on your mobile. It is connected to your brain and your sleep gets disturbed. So you do not recover. And your hormones, this leptin and ghrelin balance. So leptin is a satiety hormone. So it signals your brain that you are not hungry now. So there is a lot of leptin insensitivity or resistance in your body. So we do not feel that are, what do you say, ki abhi bas we have to stop eating now. We keep on eating, because the ghrelin levels are high. So if the sleep is proper, there are studies. If sleep is good, then the leptin and the ghrelin levels are balanced. We will eat subconsciously. We will eat less. That will add on to your weight loss. Then second thing is, it has been also shown in studies that if you have a proper sleep, then you will have less cravings towards sweet food. If you have improper sleep or disturbed sleep, then you will have more cravings towards pastries, processed foods, cheese, all these unhealthy things. They have done this on uh, volunteers, and they have seen that those who are not allowed to sleep, they were subconsciously serving more unhealthy foods on their plate, and those who have good sleep, they were happy with the healthy foods. So sleep affects your hormone levels, exercise affects your hormone levels. So even the mobile, the amount of time you stay in front of the screen, or amount of time you stay with your mobile, or scrolling on Instagram or any other social media, that affects your hormone levels. And also the sedentary lifestyle, the insulin resistance, that also affects your weight, your increase in weight, and the chances of increasing the heart disease. So what I'll recommend is, switch off your mobile or put it on flight mode at least 30 minutes before you sleep. And when I'm saying sleep, it doesn't mean that you're sleeping at 12 o'clock at night. Sleeping means at least try to sleep before 10 o'clock. You have to change this lifestyle, because our human lifestyle, human sleep is biphasic. Biphasic, when I say, means you have to sleep 15 minutes nap in the afternoon and 8 hours sleep at night. That means you should sleep at 10 o'clock till 5 a.m. or 6 a.m. It will take time, but you will get this habit back. And mark my words, you will see a drastic change in your energy levels. Your blood test levels will change. Your diabetes, sorry, your blood glucose levels will change. Your cholesterol levels will change. Everything will change.
Sounds so simple, doctor. I mean, it's sometimes it's just the choices that we make,
Yes.
that can really help us with our lifestyle, with our lives. Now,
Yes.
doctor, many times, when patients are doctors kind of prescribe statins or BP medicines or diabetes tablets, the first thought that comes to our mind is, will this be a permanent thing? Should they always hesitate to take it?
Yeah.
So, can you explain how these medicines actually work inside the body and whether it's really slowing plaque buildup, reducing strain on the heart, and improving how
Yes.
kidneys handle sugar?
Yes. So what I see in my day-to-day practice is whenever a patient goes to a physician and the physician write down these drugs to the medications to these to our patients, as you rightly said, that they are very hesitant. So first they will try and avoid, they will do some home remedy or they will try and do some exercise without the knowledge of healthcare practitioner, or they will try some other disciplines like homeopathy or Ayurvedic, and ultimately that doesn't work. Okay, so you have to go to those allopathic medicines which has been proved by research, which has been proved by strict control of the agencies and everything. You have to take those medicines, and it not like that. Once you start taking those medicines and you are done, like lifelong, you have to continue. It is not like that. So even if you start taking those medicines and you try these lifestyle modifications, I have seen many patients in my practice, their diabetes tablets are going from 2 to 1, 1 to half, and half to without tablets. It happens even for blood pressure levels. I can share contact numbers of my patients whose blood pressure tablets have been reduced by following lifestyle modification. But initially you will have to take to cut down the risk. If you're resistant to take those tablets, then tomorrow you may land up into some complication. You may have to do some other more than these tablets. So it's better to take tablets, try lifestyle modification, visit your cardiopulmonary physiotherapist, take a lifestyle modification advice, do those lifestyle modifications. Sometimes the problem is genetic. Sometimes you will have to take those tablets. Sometimes in 1 in 100 patients, uh, their blood pressure level, it doesn't come under control. Maybe it's family genetics, maybe the lifestyle, or maybe the office stress, which is, sometimes those who are in very high stressful job, so they will have to take those tablets. So it's okay sometimes to take, unless you are preventing the complication. So it's happy to pop in a tablet rather than becoming a stroke patient. So there should not be any resistance. It is just like you are having your breakfast or your food. You should take those tablets and try to help your own self. And there are times there we have seen many patients in our practice where they are off the tablets now. And it is not like that you are in your 60s or 70s, you cannot go off the tablet. We have seen patients in their 70s also going off the tablets. It happens.
Good to know. So, doctor, normally we just, when we go in for test, we take the sugar test normally.
Yes.
And then there are markers like LDLC, APOB, kidney test, and inflammation markers. Now, how do these tests help to uncover hidden risks early? And how should the patient use these tests to track their heart health?
Yes. So, as I said, the disease, you should be able to catch the disease early in the stage. So, all these tests, what you have said, it it signals that something is going wrong in our body even before the symptoms. So, these tests are very sensitive. LDL test or apoprotein B or kidneys, that something is going wrong. You need to take measures now. Okay, so they try and detect these changes very, very primitive in on a very, very primitive stage. So if you come to know that, okay, the blood glucose levels are not normal, or I'm at the pre-diabetic stage, so you'll be able to identify diabetes at the pre-diabetic level. So you may not go on insulin directly. Sometimes people come to know diabetes. I have seen patients when there are stages when they get their grade 2 amputation, means उनका cut करना पड़ता है grade 2. So they come to know then because they have not done the test all their life. or they have not visited the doctor, they have been doing some home remedies, or they have been ignoring their health. So it is always advisable after the age of 35 or after the age of 30, because we Indians are prone to heart disease early in our age nowadays because of our lifestyle, because of our stress levels, because of our food habits. So we need to do this test, start doing this test early in the age, like after 35 or maybe after 30, if there are heart disease history in the family. So do this test, try and find out the disease at the primitive stage, and treat it with the as you just said, that you may not take able to take the medication, or you may be able to do it with lifestyle, scientific lifestyle modification, not by home remedy. So it is nothing going. It's nothing wrong to visit a doctor or take his advice. Okay, just take his advice, and he will give you the right advice because they have been trained to do that. Okay.
So doctor, also, normally we hear people say, "Arey, he had a sudden heart attack and, he passed away," or he had a sudden heart attack, they were never aware of it. So, how do we know that the damage is building up slowly, over the years, and it's not a sudden thing? So, can you explain how the plaque forms and how does it become unstable? How timely
Yes.
treatment can stabilize this or even reverse this danger?
Yes. So simply, if all of us can imagine the pipeline through which the water comes to our home, so there are rusting of those. So basically, this blockages mean rusting of our arteries. So when this rusting starts, it can start because of the age, or because of our sedentary lifestyle, because of our food habits. So when it starts, the artery starts, you know, getting clotted or clogged because of the cholesterol or because of the plaques. So how to identify this early in the stage is what I will say, this that the early markers are waist to hip ratio. If your waist, the diameter between your navel and the pelvis, is increasing more than the hip, that means you are going obese. The fat in the hip should be more rather than the fat in your waist. Okay, so that is one. Second thing is, if you see, as I said, you should get your test done once in a year. So if you are seeing hyperglycemia or pre-diabetic, that means something also going wrong. Irrespective of any disease process, the clogging of the arteries goes on in our body. It is a natural process. You have to just delay it. And how we can delay it? By adapting healthy lifestyle. Now, healthy lifestyle just doesn't mean, people have mistaken the healthy lifestyle by just by doing exercises. That is why these sudden deaths are happening. They are sleeping at 10 o'clock in the night, getting up at 4 o'clock, going for a 10-kilometer run. They think that abhi 10 kilometer chal liya, I am a bulletproof man now. So it doesn't happen that way. I have seen people running on the highways in lot of air pollution. So there are researches which is coming up. This air pollution is one of the risk factor for heart disease. So exercise is just one component of the heart disease or prevention of heart disease. You need to take care of your physical activity. That is one, that is exercise and being active throughout the day. You have to take care of your diet. Now second thing what I'll tell about the diet is, there is a lot of protein fad nowadays. Everyone is on protein, high protein, high protein, high protein.
Yes.
So protein, remember, protein doesn't give you energy. अगर आप देखो आपके आसपास जो भी हाई प्रोटीन डाइट पे है, he will be lazy, he will not have energy, he will not be able to think faster. Definitely he will lose weight, but he will be dull, or she will be dull. So we need a balanced diet. We do not require a processed food diet. So exercises, physical activity, diet, then sleep, And running 10 kilometers or 10,000 meters, 10,000 steps, what many people follow, these are not magic bullets. Then you have to add on strength training. Strength training means lifting weights. Now, by lifting weight, I don't mean that you go and lift heavy weights. You have to do some kind of resistance training so that your muscles become strong. Muscles are the most important organ of our body, which we have been ignoring. The amount of muscle starts reducing after the age of 30. So we need to keep building our muscles because muscles are metabolically active tissues. Metabolically active tissues means it keeps on burning the fat automatically even if you don't do anything, if you have high muscle content. आपने देखा होगा कि आपके आसपास जो कुछ लोग हैं वो बहुत खाते हैं बट दे आर वेरी थिन, और हम थोड़ा भी खा लेंगे तो हमारा वेट बढ़ जाता है because their muscle mass is high, they are high in their metabolic rate. So even if they eat good amount of food, or maybe they are good in taking their sleep, the sleep pattern is good, they're not gaining weight. So prevention of heart disease is multifactorial. It is a commitment. Prevention of heart disease and diabetes is a commitment. It is not like a fever, that fever आया और जुकाम आया हमने tablet लिया और चला गया. We have to be committed to it throughout our life to stay healthy.
So thank you, doctor. Those were such great insights and information. And I'm sure the audience has picked up quite a few points that they are going to follow. So with this, we come to the end of our questions. And I would request the audience, if you have any questions that you would like to ask doctor, if you can unmute and ask, or if you would like to put it in the chat box, we could do that as well.
Thank you, Jay, for all your questions. I hope I was able to answer.
Yes, yes, it was some hard-hitting facts which, there are so many myths actually these days, and even thanks to social media, there's so much of misinformation
There is a
also.
lot of misinformation.
So
So as
we
I
don't
said,
really know what to
yes,
follow and what not to. It's like a fad, Sometimes they say, okay, protein, today it's proteins, tomorrow it's something else. So
yes,
you're
yes.
always kind of yo-yoing between all the possible
There is no shortcut
information.
to healthy life. We
Correct,
have to be committed. We have to be consulting healthcare practitioners, and we have to be doing right things.
exactly.
That
So
is why these
doctor,
sudden deaths are happening,
correct.
because these people chronically deprived of sleep. That is one. Second thing, they are on these protein diets, so there is no energy in their body left. They are still pushing hard just on the social media's pressure, or because of their trainers are trying to push them.
Correct.
That is second. Third, they are on fat burners, other supplements. They're not eating properly.
Correct.
There's a lot of stress. So all these things we need to understand that healthy and a pic which is getting you 1,000 likes, what is more important to you?
Exactly. So we have received a few questions from the audience earlier,
Yes,
and maybe I'll just go through them so that we can have that answered. So one of our members have asked, my LDL and LPA readings are quite high. Otherwise, I am a healthy individual with 58 kgs weight, and I also run around 150 to 180 kilometers per month for the last 7 to 8 years without any discomfort. No blood
very good.
pressure, no sugar. So what additional tests are required in my case?
There are no additional tests required. What I think is you require a good lifestyle advice. Where are you missing onto it? Like, as I said, I've been stressing upon on stress and sleep and physical activity.
Okay.
So you are doing the exercise, but what about the entire day? Are you physically active in the entire day? So if, and the second thing is the processed diet. What amount of processed diet is there in your meal? So if you take care of these, then I think you will be hitting onto your target by reducing these levels. And lastly, if the genetics are involved, then it is difficult to get them controlled.
Okay. So, doctor, another question is what is the connection of blood pressure and heart problems? And is high blood pressure reversible?
Yes, so there is a very direct connection between blood pressure, high blood pressure, and heart disease, as I said, because it injures your artery and it starts clogging your arteries with high blood pressure. That is one. And yes, the high blood pressure is reversible till some extent depending on the cause. So if the cause is some as type 1 and type 2 diabetes, the blood pressure can also be classified as primary hypertension and secondary hypertension. So if this is a primary without any cause, then definitely we try and reverse it to the some extent. But if it's secondary because of some other reason, organic reason in our body, because of some renal reason or some other reason, hormonal reason, then it is difficult to get it reversed.
Okay. Okay. What are some of the exercises that you recommend should be done?
I always recommend three types of exercise, or rather four types of exercise to be completely fit. The first is the aerobic exercise like walking, jogging, running, swimming. The second is the strength training, as I just said in the one of the question. The third is the flexibility, that the mobility exercise, and the fourth is the balance. So as you grow old in your age, you try to lose balance. So balance exercise is also important. So these are the important components of your fitness. So aerobic exercise generally we recommend 30 to 40 minutes of walking, jogging, running, swimming with moderate intensity. That means 50% of your strength you should be using to do this exercise 30 to 40 minutes. Okay, with additional warm up of 10 minutes and 10 minutes of cool down. Then strength training minimum 2 times a week, and flexibility before and after every exercise, and balance training after the balance exercises after the age of 40. So these
Oh,
exercises are very important if you want to be fit.
okay. Uh, Another question is many people try to live a very healthy life for years, like good diet, yoga, meditation, no bad habits, yet still end up with high cholesterol or heart blockages. How does this happen?
So as I said, this process keeps on going no matter how you try hard. You can only delay this process. You cannot stop this process. That is first. And even if you're living very healthy diet, that you should get yourself get a consultation and see where are you missing. Whether your sleep is missing, okay, whether your physical activity is missing, or the amount of intensity you are exercising. I see a lot of diabetes patients. I talk to them. I ask them whether you exercise. He says, "Oh yes, I exercise every day. I go for a 5 kilometer walk." But he is taking the same strength of tablet every day. That means the exercise are not being effective. So he needs to get the exercise prescribed scientifically.
Okay. And then he goes on to ask, how can patients understand the real reason why there are so many mixed messages about when there are so many mixed messages about cholesterol, statins, and angioplasty?
No, see, mixed messages about cholesterol, that there are few studies in between saying that cholesterol is good, few are saying cholesterol are bad, you should not take statins. So the answer lies in you should get yourself checked.
Checked.
Okay, so if your cholesterol levels are high and it is not getting controlled by any of the measures, then you should be taking statins, I think.
Okay.
And get yourself again checked once you're taking statins after 2 months. And if it is under control, then you can reduce the dose with the consultation of your practitioner or your family physician. And
Oh,
then again, you keep on doing those healthy measures, then maybe you can stop the statins.
okay. So the last question here, someone recovering from a stroke, how can they improve their speech fluency and manage memory related difficulties? What
So,
practical steps or theories really help in everyday life?
so stroke happens when there one part of the brain stops receiving the blood supply, to be in the very layman language. But what I recommend to my patients is if you want to improve the fluency of your speech, keep on talking, keep on listening, read the newspaper, just practice, 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 and still not happening, do consult a speech and language therapist. Always take a scientific advice and practice, practice, practice. And if it is still not happening, definitely you should visit a speech and language therapist.
So, any questions from the audience?
Any questions? I'll be
I
happy
think
to
you
answer.
did Such a wonderful job explaining everything that I think we've got a lot to go over and think.
Yeah, doctor. Good evening, doctor. I want to ask one question.
Yeah, good evening, Pratik. Tell me, please.
Yeah, sir. Even though you answered my question that
Yeah.
I'm a physically active person running 150 to 160 kilometers per month, but
Yes.
genetically my readings are not good. My
Yeah.
LPA level is around 90. It should be less than 30. So
Mm-hmm.
if I'm doing high intensity exercises or like running, so
Mm-hmm.
means what precautions should I take? Can this LPA level cause some difficulties in my running, even though I'm running for last 7 to 8 years.
No, no, yes, yes, Pradeep, you're doing a good job that you're running for last 7 to 8 years, and even if your levels are not getting, and first thing what should you should remember is you should be doing avoid high intensity exercise. First thing, if you're doing high intensity, I don't want to discourage you, but I'll come to your point. If you still want to do a high intensity exercise, do high intensity interval training that is less risky. Okay. Second, what I'll suggest is do a moderate intensity exercise. For an example, you are running for 20 minutes with a high intensity or high intensity interval training. You do a moderate intensity exercise for 40-45 minutes. That will help give you more benefit scientifically. That is one. Second thing, try and see whether the amount of processed food in your diet is more, what amount of easy glucose you are taking, like tea, coffee, or cola. Try and avoid that. And sleep patterns, if you do these three things, then definitely your level should come under control. And are you taking any medications for this? Have you visited a cardiologist?
Yes, sir. I am doctors have prescribed me statins, and I am taking it for last 2 months. And I have
Okay.
to undergo test. I think after some days whether LDL has reduced or not.
Yeah, so take those statins and try to control your stress levels. Try to be more scientific in your sleep. Switch off your mobile or at least put it on flight mode. And try to reduce processed food in your meal and do a moderate intensity training. And one more thing, add strength training. Try lifting weights 2 times a week at least. And
Yes,
then
sir.
you,
I am doing
then,
sir resistance training, and with TheraBand I am doing strength training. And
okay.
eh, yeah, just I was concerned that means it may cause my like risk factor may be increased if I do that. I got the answer that I should do it in a scientific manner. Yeah.
Yes. Yes. Try
Thank you, sir.
and do moderate intensity training and extend your time. Even if you're doing like 20 minutes high intensity, do it moderate intensity and do it for 45 minutes. That will be that has a less, that carries less risk.
Sir, just 1 minute. Okay, can I go for another test like calcium score or that will give me a true picture
No,
what
no,
my
no, no,
heart
no,
is?
no, only if your cardiologist recommends.
Okay, sir. Okay, okay.
Don't worry,
Thank you.
don't worry,
Okay.
what, just do what I said. Increase the timing, reduce the intensity, and sleep timing.
I'll do,
You
sir. I'll do. Thank you very much. Thank you, sir.
Yes.
Any other questions? So I think no more questions. So
Yeah.
as we wrap up here today, and thank you, Doctor, for such an insightful session.
Thank you, Jaya.
I'll just try to summarize simple three takeaways that maybe we can take away and implement in our lives from today's session. One is lifestyle enhancements. Maybe make small daily choices every day to protect your heart and be committed to staying healthy. Second, I think I heard you say it quite often was sleep, sleep, and sleep.
Yes.
So, sleep well, sleep in time, and get your dose of 8 hours of sleep and maybe a power nap in between if possible.
Yes, very important.
Uh, and the third was gift yourself on your birthday and go and meet a cardiologist to get your cardiac test done.
Yes.
Keep prevention, and prevention always works better than emergency care. So prioritize preventive care better than going for emergency care. And be physically fit, no more sitting if it's over 20 minutes. So get up, maybe take a few steps and come down and then continue with your work. So, Doctor, anything else that you would like to add that they should follow?
No, that's all from my side.
Okay. Okay. So, on behalf of Heart Health India Foundation and SOC VPR, I sincerely thank you, Dr. Varoon Jaiswal, for your valuable time and your insights, and to all you attendees for joining us today. You have really taken out the time to prioritize your health. So, that is like the first step towards a good, healthy life. And thank you so much for being such a good audience. And
Thank you so much. Thank you so much, Pratiksha. Thank you so much, Jaya. Thank you, everyone. Please share your feedback on the chat box or on the WhatsApp group. I'll be happy to, read to your feedbacks. Thank you so much.
thank you. Thank you once again and have a good evening. Thank
You
you.
Thank
too.
you, sir.
Bye.
Thank you, everyone. Thank you, sir, Jaya ma'am.
Thank you.